The topic of our discussion today is Introduction to Pathophysiology. First of all, what is pathology? Pathology is the study of disease, and as pathos means disease and logos means study, it is a branch of medical science in which we study the structural and functional cause, origin, and nature of human disease. Blood, body tissues, and other body fluids are analyzed to assist medical practitioners in identifying the cause and severity of disease and to monitor the treatment process. Branches of pathology. First is the chemical pathology, which means the study of chemical constituents like proteins, electrolytes, enzymes, and toxins in various human body compartments. For example, blood urea, serum creatinine. Then is hematology, which is the study of blood cells and other components of blood. For example, CBC, peripheral smear, PT, APTT. Then microbiology, which is the study of infectious diseases by microorganisms including bacteria, viruses, fungi, etc. Then histopathology, which is the study of body tissues and biopsies, for example, uterus, appendix. Cytopathology, which is cyto means cells and which is the study of abnormal cells in a diseased tissue, for example FNAC of lymph nodes. Then is immunology, which is the study of immune system and immune disorders. Then comes molecular pathology, which is the study of molecular mechanisms of the disease, for example PCR in case of hepatitis B, C, and in case of coronavirus, etc. So here comes your first MCQ. What is the study of abnormal cells in a diseased tissue called? Microbiology, hematology, histopathology, or cytology. Then comes pathophysiology. Patho means disease, physiology means functioning. So the study of disordered or disturbed physiological process associated with the disease is known as pathophysiology. Pathology is a paraclinical medical science because we are studying the structure and function of the diseased human body. But please remember, it is not about managing the disease process. On the other hand, basic biomedical sciences mean structural, functioning, and chemical constituents of human body. And the clinical medical sciences are dealing with the management of disease process but not include the functioning or structure or chemical constituents of normal human body. And the clinical medical subjects are medicine, surgery, peers. However, basic medical subjects are anatomy, physiology, and biochemistry. And the abnormal anatomy and disturbed physiology and biochemistry of human body in case of a disease is known as pathology. There are few core components of the disease process. First is prevalence, which is defined as the proportion of the population affected by the disease process at a specific time, which includes the number of already existing cases plus the number of new cases per million population. Then comes etiology, which means the cause of the disease, pathogenesis, which means the mechanism of disease development, and morphology, which means the structural changes induced in the cells and body tissues due to the disease. Morphology is further divided into the gross, which appear without cutting on the naked eye, and then comes the cut section, when the body tissue is sliced into two halves, how the diseased organ looks like from inner side. Then comes the microscopy or histological picture. Then comes the clinical manifestation, which is the signs and symptoms or the functional consequences of morphological change. Then is the outcome, which is the final result of disease, whether resolution, complication, recovery, or death. For example, in case of COVID-19, as you can see the prevalence here, the total number of cases, which is 13 lakh plus the new cases 16,000 plus cases, all of them together is the prevalence. However, the new number of new cases means incidence. Then its etiology is coronavirus type 2, the new coronavirus, and then the pathogenesis is the cytokine storm syndrome, which includes the surge of interleukin 6 and other cytokines, which lead to activation of alveolar macrophages and massive destruction of lung parenchyma. Then is the morphology, as you can see by arrows in the pictures. This is the histological section of the lung showing inflammatory cells and the dissolution of the lung tissue by alveolar macrophages. Then come the clinical manifestation, which on the extreme right side you can see fever, fatigue, dry cough, aches and pains, running nose, sore throat, short of breath, diarrhea, then respiratory hunger, and then respiratory failure. And the final outcome is either recovery or death. Now, what is pathogenesis? As you know, genesis means birth, patho means disease. So, the process of disease development is known as pathogenesis. It can be acute in case of the rapid origin or rapid course of a disease, for example, acute hepatitis A, acute myocardial infarction, which means acute heart attack, and then some disease have chronic or gradual long course, which is known as chronic diseases. They include, for example, diabetes mellitus, hypertension, or chronic hepatitis C. Then some diseases which occur repetitively, these are known as recurrent disorders. So, question number 2, what is the gradual onset of a disease process known as? A. Acute, B. Chronic, or C. Recurrent. Then comes the natural history of a disease. The natural history of a disease starts with the stage of susceptibility, where the pathogen is there and the human body can be anytime exposed to the pathogen. And then comes the exposure. After exposure, the subclinical stage of the disease starts when the pathological changes occur at a molecular and at microscopic level. And then is the onset of symptoms. For example, in case of corona, there is the onset of cough and other symptoms, and after a couple of days or after a couple of time, there is the diagnosis is developed, and after the diagnosis is developed, the disease takes its course of clinical stage. And during this, if the appropriate treatment is given, the patient can recover, or if the system is strong, the patient can recover without any disability. Or if the disease is damaging, it can cause the disability of the patient. Or if the patient cannot recover, immunity fails, and the disease is very much lethal, the patient dies. For example, in case of coronavirus 19 SARS-CoV-2, the natural course is the early stage viral infection when there are mild symptoms and signs, and then it's the stage 2, which is the pulmonary phase when the lung damage starts, and then is the stage 3, which is hyperinflammation phase when the inflammatory markers like interleukin 6 and CRP and the ferritin, etc., they have extremely high surge and cause cardiac damage alongside with the pulmonary damage. So, as you can recall from here, the first stage was the stage of susceptibility when the pathogen is there and there are chances that the human body can be exposed to the disease. It is very much important because in the preventable and communicable diseases like SARS, COVID, COVID-19, the period of susceptibility is the most important in deciding the disease process. So that's why we all are staying home so that we can stay safe. For example, when a normally one person will be infected, he will infect 2.5% people, 2.5 times people in 5 days, which may reach up to 406 people in 30 days. However, if he or she limits their outdoor activities to 50%, then chances of developing disease in 5 days is in 50% less people, that is 1.25 people. And then in 15 days the chances of spread of disease is much more reduced, which is in 15%, 15 people. However, if the patient or a person who is infected is absolutely stays home, then you can see here that there is massive fall in the spread of disease, which is only 2.5 people in 30 days. That is the importance of social distancing. So you will have to mark the MCQs and mark attendance in the comments. Thank you. This is our next lecture, cellular adaptations, which we will discuss next time, inshallah.